Welcome back, PsycU community. Becky Wong here from the Otsuka Field Medical Affairs team, and welcome to our final series recording on the 12 step to inclusivity in mental health services. Thank you all for joining us. Today's recording is sponsored by Otsuka Pharmaceutical Development and Commercialization INC and Lumbeck LLC. I am an employee of Otsuka, and our speaker is a paid consultant for Otsuka. Materials were developed in collaboration with our featured expert speaker, Dr. April Thames. Dr. Thames is the professor of psychiatry, chief psychologist of the adult division in psychiatry, and associate director of medical psychology assessment center at the UCLA School of Medicine, and was the past associate professor and clinical neuropsychologist in the Department of Psychology and Psychiatry at the University of Southern California. Dr. Thames have led several projects funded by organizations such as the National Institute of Health, Alzheimer's Association, and Robert Wood Johnson Foundation. Broadly, her work focuses on social determinants of cognitive health with a focus on how racial, ethnic, and socioeconomic disparities impact cognitive and mental health outcomes. Thank you, Dr. Thames, for joining us. And at this time, I will turn it over to her so she can walk us through the final series.
Thank you, and hello, PsycU community. In this series, we're going to talk about treatment recommendations and culturally responsive care. We know that treatment recommendations are often approached as a one-size-fits-all. So we will tell our patients, do this or do that. And I find in my field as a psychologist, sometimes when we do an assessment, by the time we get to the end, to the treatment recommendations, which are so critical, we get really lazy and we give some bullet points of do psychotherapy, go get an MRI scan, or whatever it is. And it is not appropriate to do that. We need to be better and more thoughtful about what kind of recommendations are we giving to our clients, and is it respectful of who they are in terms of their cultural background or socioeconomic background, whatever it is, we want to be more mindful. So your slide has an example, and I will go ahead and just read it, and we can discuss hopefully later of how this could have been better handled. But we have Miss Ortiz, who sees Dr. Kirk after experiencing a number of panic attack episodes. Miss Ortiz was diagnosed with panic disorder and prescribed anti-anxiety medication. Sounds pretty reasonable up to this point. While the anti-anxiety medication is helpful, it does not fully abate Miss Ortiz's symptoms. So Dr. Kirk suggests that Miss Ortiz should spend at least 30 minutes per day walking around her neighborhood for exercise. Sounds okay up to this point. However, what Dr. Kirk failed to understand is that Miss Ortiz does not live in a safe neighborhood. And taking a walk in her neighborhood, not only could it be dangerous, but it could actually further promote anxiety. So had Dr. Kirk really assessed Miss Ortiz's what we call macrosystem, so the context in where people live and their community, that's what we're referring to, a better treatment recommendation could have been made. So in order for us to be culturally responsive, we have to keep in mind a number of factors, and we have to think about consideration of our client macrosystem, including the family system, in order to provide continuity of care. So as we integrate the family system, it's really important in terms of recommendations. Because let's say your client has a very large family. It is possible that maybe one or two members are going to be highly influential in terms of whether or not they continue with care. So if you don't have buy-in from those 1 to 2 family members as to why it's important to adhere to the recommendation, then there's likely going to be dropout. and that's what we want to try to avoid. So it's important to engage all family members in the process. They need to understand what you're recommending and why. And we can use models from healthcare in terms of how to integrate family systems. But often it's the case we think, oh, our client or our patient, that's the only person to focus on. And the truth of the matter is, it is going to be the family member who is encouraging them to continue on with treatment. So as we think about macrosystems, this is referring to the larger culture as a whole. So thinking about socioeconomic status, wealth, poverty, the communities where people live, the workplace where people are employed. The macro system is dynamic, so it's not a stagnant enterprise, and we have to think about how these dynamic shifts may affect our clients. So as we think about the example I provided earlier with Ms. Ortiz and Dr. Kirk, and keep in mind the recommendation to help with anxiety was to exercise 30 minutes and perhaps just do some walking around the neighborhood. But because Ms. Ortiz lived in a high crime area, that was not integrating the macro system. So had Dr. Kirk assessed the macro system, in Ms. Ortiz's macro system specifically, he would have learned that Ms. Ortiz's older son is a physical education instructor at the nearby high school and has access to the track. So he could have provided a more specific recommendation that was tailored towards Ms. Ortiz and what she is able to do. The general recommendation of walking around the neighborhood, that is something that we often tell our patients, but we have no idea about their neighborhoods. And so if we find that our clients are just not able to access certain type of services, we have to think through with them what's an alternative solution. And I see this all the time. I see inappropriate recommendations that are not going to be covered by their insurance, but they're provided anyway. So that's not helpful. We have to be very mindful about, is the recommendation I'm providing, will it be covered by their insurance? Is it really possible for them to get to the facility to do whatever it is that I'm recommending? So these are things that are going to take more work, but it provides a more culturally responsive way of a treatment recommendation. So how do we ensure continuity of care? Well, there are 3 types of ways that we can ensure continuity. One is informational. So us as providers should be talking to each other to ensure that information that is important for the other provider to know about the client and as it pertains to culture and everything else we've talked about in these series, that's really important to communicate. It's not fair for the other provider to have to figure this out all over again when you've done a large part of the footwork. Management continuity is achieved when services are delivered in a complementary and timely manner. So it's not appropriate for there to be a huge delay. And if there's going to be a delay of any kind, we need to think about what steps can we put in place while that client is waiting for another type of care. Relational continuity refers to ongoing personal relationships. And this is between the client and the professional and team of consultants. So making sure that there's a relation not just between you and the client, but also the client and the whole team, especially if you work in integrated teams, which I do. I provide a lot of consultation liaison service, and it's really important for me to communicate with the team and with the client and to make sure that the client knows how to communicate with the team and vice versa. And one way that continuity of care has been implemented, or methods of continuity of care, has been through patient navigators. And there have been several studies that have demonstrated how essential patient navigators can be to really support patients through multi-levels of care and entitlements. And for communities of color, we know it's important that the patient navigator is a member of their community because they know what's going on in the community, they know what services, can be provided, and they can help walk the patient through that process. And so as we think about patient navigators, we know that there have been some sort of outlines about how patient navigators should function. And they do many things. They can assist in the coordination of other types of health care services. They can facilitate involvement of community organization and patient access to care, notify the patient of clinical trials, anticipate and help patients overcome certain types of barriers. We mentioned some of the structural barriers earlier. They can coordinate with insurers, which is extremely helpful, and to conduct outreach with regard to mental health disparities. So teaching the community, what does depression look like? What is it that when we say we're stressed, that in some communities is a term for depression, and to really be mindful of that. So we as the provider are not going to be able to go in the community and gain their trust immediately. It takes time, but that's why the use of patient navigators and community stakeholders are key, because that is who the members of the community trust. So in this series, we discuss some ways to provide culturally tailored treatment recommendations and ensuring continuity of care. And it involves learning more about the patient's whole entire system, where they live, where they work, their values, and also thinking about what community stakeholders or navigators can help them with services that may not be immediately available in the larger healthcare setting.
Thank you, Dr. Thames, for bringing this valuable resource to our community. And I would like to encourage our audience, if you haven't listened to the other series so far, please check them out. We hope you found this series to be helpful. And this concludes the series on the 12 steps to inclusivity to mental health services. Thank you so much.